In this video, we want to introduce the students to some of the concepts of simulation, such as a fiction contract that we enter into with our students, a basic assumption that we have for all our students. We want everyone to understand how they can interact with the mannequins, and we also want them to understand the roles of some of the other people in simulations, such as the confederate. We'd also like to just give them some general advice for participating in simulation.
Simulation is a tool for learning, and that it puts people in the middle of a complex scenario that is challenging so that they're able to learn, but not so challenging that they become frustrated. We have many people come to simulation: physicians, nurses, pharmacists, social workers, chaplains, and then we have a wide array of students. So anyone that has anything to do with a healthcare setting can come through simulation and learn.
We hold the basic assumption about all participants, and that we believe everyone is intelligent, well-trained, and that we're all here to get better taking care of patients. We want you to treat this scenario as if you are really taking care of a patient.
Okay.
Okay.
Just take a nice deep breath.
The fiction contract is something that we establish with our learners that really lets them know that we understand simulation is not real.
We're going to do our best to make this experience the best it can be for you, but we ask that you make a contract with us that you're going to step into the fiction.
About 5 months.
So you haven't had pneumonia in 5 months?
No.
Okay.
When we create scenarios or simulations, we pull in things that we've experienced, real life situations. So you have to create something realistic. It's not always going to be one person and the patient and everything goes perfect. And a lot of times students think we try to deceive and trick them, and we don't.
It's nothing that you're getting tested on. It's simply just a learning experience. I think the more you put into it is what you gain from it.
It's not for a test, it's for learning. So we want you to go in there and take some risks. If you think you have an answer, then say it. We want simulation to be a safe learning environment where you can make mistakes, you can make decisions, and there are no ramifications for it. And no one should make fun of you or think that you are not smart because you made a certain decision based upon the knowledge that you had. When learners come to a simulation, we want them to treat our mannequins as real patients. We want you to administer medications, use a defibrillator on the mannequin, start an IV on the mannequin. As much as possible, we try to have the learners do everything as they would in a real situation.
They can go through every single step of that patient care process.
Your job is to get the history from the patient and respond like you would in real life.
You will come into a patient room and we will let you know the background, we'll let you know where you are. Are you in the emergency department? We'll tell you if you're in a clinic. We will tell you if the patient is needing to be admitted or if they've already been admitted. And then we ask you to practice as you would in your role. If you're a nurse, we want you to practice within the scope of nursing. If you're a physician, we want you to act as if you are a physician and you play your role and interact with that patient and administer medications and prescribe orders as you would in a realistic care setting.
Once you're in there and you see the vitals going downhill and the patient struggling to breathe, you really get your adrenaline running.
It's at 3 now.
Then you can go ahead and turn it up to 5.
A confederate is one that is in on the case or in on the situation. Their purpose is to facilitate the simulation and be sure that everything kind of goes okay in the room. They help with equipment. They clarify, can you start an IV or not start an IV? They answer questions about, will the labs come back yet, or where's the chart? So they're really there to be sure that the learner doesn't get lost in the room when things may not be exactly like a hospital room.
How long do they have IV? Maybe I just put it in the ER.
We always have someone in what we call our control room, where we have a physician or a healthcare provider or sometimes a simulation technician running the mannequin.
The mannequin has the ability to be manipulated on a computer by the operator. And the operator can also have the voice of the mannequin, as well as manipulate the vital signs and the clinical conditions and different things that can change.
Did you take it home?
Well, I take aspirin, I had one already, and I take a little pill,
Okay.
and a blue pill, and a water pill, and a sugar pill.
We will have consultants, so if you feel you need to call a consultant for any reason, you can ask the Confederate in the room to page a consultant, and that person will either come into the scenario to help you or call on an intercom. After every single simulation that we do, we go back to a room and we debrief, and we really consider this to be the most important part about simulation, because this is where all of the learning occurs. This is where we talk about how you felt about the simulation, what were your concerns, what decisions did you make, and why did you make those decisions, and then take it to the next level of how to apply this in the real patient care setting.
We kind of talk about what we did, what went wrong, what we did right, what we didn't do right.
You get to see what were the others thinking in the room, were you all on the same track, what to prepare for the next time or the next clinical simulation you may go into.
We usually leave each one feeling a lot more confident about, if we were faced with that again, what we would do the next time.
The simulation is a way to get us involved with an entire care team in a real-life kind of situation.
What I would say about simulation is it's necessary. It's one thing to get the answer correct on a test, but it's another to actually be able to do it on the spot.
Put the idea that it's a mannequin and not a real patient out of your head. Also, I would say treat the patient and not the vital signs or the labs or any other piece of information that might be presented to you. Just like in real-life medicine, treating the patient is most important. So.